in a world where every question is asked to ChatGPT, and ChatGPT is actually answering every question, this session really becomes important. So my first question is to you, Mr. Dr. Shetty. How is tele-gynecology improving women healthcare access in smaller cities? And what are the main challenges in implementing AI-driven tools in Tier 2 and Tier 3 cities?
Before I go to that question, I'll share my experience in 2000, maybe 2000. I'm practicing now for almost 35, 40 years. So I used to go to a place called Pusar, which is in eastern Maharashtra, for infertility. And the reason was, one patient from there came and conceived, and then she went back. So her father said, not many patients can come here. Doctor, can you visit once? And to my surprise, when I went, the tradition was the man should marry, the woman should pay dowry. If she doesn't conceive, he should remarry. Second wife, again she pays dowry. Again she doesn't conceive, all three should sit and cry, do nothing. So I went there, I saw that, and it moved me. I said, I'm sitting in my clinic doing nothing, and I'm waiting for them to come. How about me going there? Yes, it was a pain traveling with all my equipments, everything, and doing surgeries there, but it was working. Now I come to today. Today, it's not possible for everyone to travel, and that's what happened later on, that not everyone can travel. But today, I can give video consultations. I can have algorithms. I can have the reports coming. So I can analyze the reports and I can, help them out there. So today, yes, it is definitely working. It is definitely a new way to look at managing patients in the Tier 3 or Tier 2 cities.
Okay, adding to that, I would want to ask Dr. Munjal, practo or tele-gynecology is it reliable? Because for me, I think AI cannot replace emotions. And when a young girl or somebody goes to a gynecologist, they have a lot of questions. And usually we have seen that ChatGPT or AI, they answer the question, but not in the most correct manner. So how do you think that issue can be solved eventually?
This practo and all these new AI things, these are very good. Because the patient, those who cannot come 9 to 5 job karte, they cannot come to the OPD, they can link to the gynecologist, they can ask their queries, they can tell their symptoms, and they can get their treatment on these practo. But there are few cases जिसमें हमें we need to examine the patient, we need to see the patient, we need to ask the patient's query about few symptoms. उन केसेस में we need to ask them कि हमें तो examine करना, we need to examine you. But in other cases, simple cases, gynecological, some infection, we can solve their queries on practice. Yes.
Okay.
Sorry, I would like to add something. See, these platforms are they don't have any emotion. The patient and doctor, they are not connected the way they used to when they consult face to face. The better solution could have been, in my view, is that there should be some centers wherein there is, if we talk about tier 2, tier 3 cities where they cannot avail super specialty services, so there could be some centers wherein there are locally available doctors there, which are kind of mediating patient and doctor interaction. Thereby it could alleviate 2-3 things. One is doctor is intermediating the patient and doctor. They can examine the patient and convey the result to the super specialist. And also in cases something goes haywire, some kind of emergency, they can consult the doctor, or they can be there to tackle the problem.
I would actually add that in some cases anonymity is better. I have patients who have consulted me online because they have different sexual orientation. Okay, now they would like to be mothers, they would like to be parents. Okay, so in such cases, rather than sitting in front, which becomes embarrassing, for them online consultation without their face or just talking helps.
You
I
adding
would also
something?
like to add something like on the chat box, chat GPT or in the Practo, for the routine complaints and the common things, they get the right answer. But if there is any emergency, they can't tell the patient that you are having the emergency and you have to reach to the doctor. And moreover, there is no validation of these suggestions given by the chat GPT or the Practo.
I agree totally. Dr. Ashok, my next question is to you. How can pharma and diagnostic companies collaborate with hospitals to improve telegynecology adoption?
Okay, as far as telemedicine is concerned or AI is concerned, before the COVID, judiciary was a big hurdle in the development of the telemedicines because it is highly objectionable to give a prescription online. So after when the COVID occurred all over the world, the government, it was very difficult to visit to the clinics and to get the treatment. And so in these 4 years, the telemedicine has developed and the government of India give some guidelines, strict guidelines that you can give the treatment online and the hurdles of the judiciary stop there. And then we get the opportunity for the pharma companies and for the doctors, for the big hospitals and those who are interested in the development of the new technology. They were encouraged. And now in just 4 years, AI and the telemedicine has become a reality in Bharat, and now we are going ahead. Although it is in the so primitive stage that even the good hospitals, big hospitals, and the doctors and the postgraduate doctors, those who have doctors like we, those who are practiced 30 to 40 years, we are not acknowledged with the technology how we are to use. But in my opinion, and that I as much as in 2 to 3 to 4 have I acquired, that the AI is going to revolutionize in the healthcare delivery system in the remote areas. Like a big country like Bharat with the population of 140 and 145 crores, it is very difficult to establish the hospitals in the very remote areas in 2040 years and even in the deserts. So in these very remote situations and very difficult to even to reach there, by using of the AI, you can give a very good healthcare delivery system. And the most important part of the AI is that you give the accurate treatment which doctors cannot give even you examine the patient for 5 to 10 minutes, and but the AI is going to accurate results. Just for example, even a doctor from Israel who can give the better production of the time of the ovulation, implantation and your schedule and fertility. Just like in your just come to your neurosurgery, even super specialist, there is big danger to the super specialist. There is big danger to super specialist. Suppose you are doing an operation for the neurosurgery and there is very small blood collected in the very small part of the arteriole. You just cannot do justification. But a man sitting from the 1,000 years old, he will do 100 times better results. And so the bigger danger to the is to the super specialty, whatever the specialty, either it is gynae or a dental or a neuro or a cardiac. So in the coming years, we super specialist doctors who are sitting over here, they are actually to be trained, and the hospital should be trained. Even in that medical college level, I ask any doctor sitting over here about the AI, oh, because you have not read any curriculum in our syllabus or even in the textbooks, they don't have any good knowledge that what to be done. So actually, the doctors, the hospitals, the medical colleges should be acknowledged, and this AI and telemedicine should be included in the curriculum of the postgraduate, at least in the postgraduate level, even at the levels. Only by that we can give good healthcare delivery system to our extreme level of the population that is increasing day by day, and it's a very good answer. In as far as your Ghani is concerned, as a gynecologist practicing for 40 years, it's so much. But we deal with the situations. We deal with the situation when present over there, extreme situations, extreme emergencies. But in the case of where my colleagues who are working in the remote areas with the same degree, same qualification, same knowledge, but they are killing the patient, I am saving the patient, I am present over there. But this mortality, other maternal mortality, other infant mortality, these are there, all can be decreased just by use of the AI. But it is up to TOI Times of India group that it gives the emphasis so that the I doctors at least, not the entire population 145 crores, these doctors must have the knowledge and know the importance of the AI and telemedicine so that we can serve the masses and give a good healthcare delivery system to our entire Bharat. Thank you.
You've put it really nicely and explained it really well. My next question is for Dr. Bansal. What patient engagement strategies work best in regions with low digital literacy? How can remote monitoring and AI triaging improve early detection of high risk pregnancies or reproductive health issues?
In the 2 tier or the 3 tier in cities, for the AI can make the apps in which we can triage the patient. Like we can have the wearable devices which can note the BP, pulse of the patient, or we can have different apps which can detect which patient is going to have GDM, gestational diabetes, or PIH in the future. In this pregnancy they are getting, so that they can triage the patient and send them to the higher center. So we can train there the ASHA workers there about the AI. We can provide them with the tablets also. The patient can go to the ASHA workers. They can triage the patient and send the high risk patient to the higher centers.
Okay. My next question is for Dr. Reddy. What are the key regulatory or ethical considerations companies must keep in mind when deploying AI solution in gynecology?
When we talk about ethical point of view, we should not be sharing the patient's privacy or private information to anybody. We should mask their details, and we should be taking informed consent before we publish them anywhere in any studies or articles. And we should be following the laws in that area as well, because as we know, there is a lot of stigma that's happening. Maybe they don't want to reveal their name, they don't want to reveal that condition, so we should be aware with the similar situations.
Okay, I mean, that brings me to ask, it's an open question for all of you. See, women health is an extremely sensitive data, like you just mentioned. What safeguards are necessary to ensure privacy and data protection in digital gynecology platforms?
See, first of all, the data has to be protected. So the AI platforms are very important. If there is a breach, okay, I as a physician would have not done anything wrong, but the information goes to a wrong person, it can be misused. So here comes in the role of the pharmaceutical company that you were asking, is how can they come into play? They can have and secure. How can the government come in? They can have regulatory mechanisms whereby such data breach can be found and punished if required. But however, as you rightly said, that this breach has to be seen in person, and there's a second thing about trust. Now, why should a person sitting on the other side trust me? And the same thing is, how do I know the person on the other side is just trying to, trap me or whatever, get something out of me? So there has to be that bonding. It will take time. But these issues are there.
So I have a question. So can we have that, like in the cases of the MTPs, we are not recording patient's name anywhere, only in the first prescription. So can it will be possible for the digital platform so that the patient name and identity is not revealed? This is my question. Can it be possible?
I think it can be possible. Yes, that's a good suggestion. But that will again, as doctors, my job or my social role is to treat the patient. It is not how the data should be managed. So that is what I'm trying to say. This is for the people who are handling the platform.
Yes,
And yes, we can
discussion
suggest to
for
them. But yes,
But do you think AI can replace doctors? Not replace probably, but like I started my session with that emotional quotient that every girl who is probably, I'm sure you guys get a lot of women who come to you are not married and they are scared. Do you think that that emotional quotient that you can add, AI can replace that?
Not now, but in future it may be in 2099 or 3000.
I don't think so.
Yeah,
Things
That
AI can be
emotional-
a tool to help patient as well as doctor rather than replacing them.
Yeah, AI is an adjuvant. No? It is for our help. It is for help for the doctors and the patient. It cannot replace it.
I agree totally.
there is a book called Homo Deus, O Hari, that is his, O Harari, that is his Nilo Harari, the author. And he writes, not only doctors, but every profession is slowly going to be redundant. Okay, teachers will not be required, actors will not be required, everything will be done by AI. And the only job for human being will be to produce new children or to have population growing in. But that also is going to be a job
Yes,
now,
but-
because not many are ready for that. So that is the only job probably going to be left. But yes, doctors can be replaced.
Yep, you wanted to add something, sir?
I don't agree with this. In the opinion that the question of the inquiry is that this will be replaced, the labor forces will be replaced, the jobs will be replaced, and the other very ethical values will be replaced. This was the question in our country by Mr. Basant Sati from Bombay, who was the information who minister when uh, the green tea became color tea became in our country, and he was very against of the broadcasting information minister of Bharat. He was very against of the color TV. Oh my God, the entire culture of the India will be replaced. So you are thinking today that the entire ethical system and the cultures and the human values will be destroyed if AI comes. It is just like mobile when it comes. Mobile will replace so many things, and we will be in much trouble if there is a mobile. There will be much trouble. Humanity will be in trouble, and India, like a cultured country, will be in trouble when the color TV will come. Just take it for granted. Everything has good and bad, both sides. So AI is going to very good, and it is the duty of now Times of India group to approach to the health ministry and convince them that the AI should be used as much as possible if we actually want to serve the country in the health sector. It should not be discouraged. It should not be discouraged.
See, AI can do most of the work. AI can guide us in diagnosing the things and can advise us the therapies. But the insight of the doctor cannot take, AI cannot take the insight of the doctor. There are so many ethnic variations. There are data biases according to the ethnicity. And like in our teacher always told us that every patient is a new guide, a new teacher for you. So AI can't replace that.
I agree with you totally.
But then one thing, for doctors to learn, they have to go to conferences, they have to update themselves, they have to read books.
Yes.
But if now there is computers, okay, all AI, one click of button and all over the world, the data is updated. So a drug that was used is having side effects will take a long time to reach the village. People will still be using it. But with a click of a button, it will be stopped immediately. So those are the advantages as well.
Right. Actually, that was my next question. Do you believe AI could help in triaging patients so doctors can prioritize urgent cases in teleconsultation setups? Do you think that can happen?
Yes. See, urgent patients again, here things are totally different. Just as microbiome is different, every patient is different, every situation is different. So yes, maybe AI today may not be able to help, and maybe human factor is required. And today AI will be guiding us. Tomorrow maybe we will be guiding the AI. So that can be a possibility.
AI can triage, but not every patient needs a tailored treatment. AI, how can AI get to know what every patient needs different treatment for the same disease, different treatment.
Okay, okay. You all are, in this industry for the longest time. I wanted to understand what are the most common women health issues you see that are being neglected in tier 2 and tier 3 cities? Probably due to lack of access.
It is not like the which is most common health problem is neglected. All of the problems are neglected because of the availability of the resources there. There are the less number of doctors, there are less number of the centers where they can go.
Right.
And also the awareness of the lack of the awareness to them.
One
I
of
would,
the health, I'll just complete. One of the health education sessions I had gone to as a, let us say, advisor, and this was a poor class of patients, and I was advising on diet and how to eat healthy food and how to avoid anemia. One lady stood up and told me that I have a pimple here. Do you have any answer for that? So the question you asked is what is the most common? Now that doesn't make difference because for a woman who has a pimple, maybe she stays in a slum, maybe she doesn't have enough food to eat, but that pimple was the question she wanted an answer to. So yes, all questions are important, all problems are important wherever you are.
Should I
I
add
would like
something?
to add something to it. See, as gynecologists, we deal symptoms which are mostly hidden. Other people, supposing, for an example, patient come to me who are well aware and they are well oriented to breast cancer thing, because breast thing is which is something visible, but they are not aware about the cervical cancer or uterine cancer. And when we try to educate them, it is very difficult for them to understand the severity. They don't take it very easily, they don't indulge the thing. So making the people aware is most important thing, rather than access of knowledge or access of resources. They go to breast for smallest lump. They consult a doctor, but they don't consult a doctor for any gynecological symptoms.
So you were saying something.
Should I add something to the discussion?
Sure, sir. Why not?
As far as pharma is concerned, India is on the top of the pharma industries in the world. But as far as the equipments are concerned, processes are concerned, medical equipment, 90% medical equipments are imported and they are not manufactured in India. So if this other it be MRI, CT, ultrasound, even the Doppler, these are not manufactured. We have gone to the Mars, but we are lagging behind in the ultrasound. And so all the high-end equipments, they are not being manufactured in Bharat. The government of India, with the intuition of TUI, this must a awareness all over the country that the pharma industries who are having crores and trillions and millions of rupees, they are making drugs every day. The drug that is manufactured in Holland yesterday, it will be available tomorrow in Bharat. But as far as the equipments are concerned, equipments are they are not being manufactured in India. 90% of equipments from the eye prosthesis to cardiac prosthesis to orthopedic prosthesis, and they are all being imported. And the India government is taking this interest. I have convinced many of the big millionaires of this Bharat from the pharma industries that you spare at least few hundred crore rupees for the research work on the equipments so that they are able. When for the next coming 10 years, I think that as far as your economic condition of the country is concerned, you are not going to give your own medical equipments, other MRI, CT, even the next wave to the peripheries, but by AI and telemedicine promoting it, because the hurdle of the judiciary has been come to an end. So you by AI you can very fast you can give the healthcare delivery system to the masses. So our emphasis of the equipment is concerned, that is a big process. But if the pharma industry actually if they are concerned and they want to want the the flag of the Bharat to raise high, They should spend money not on the pharmacy but on the medical equipments. Then only we can reach to the masses. But it is at least 10 years, 10 it will take years. But by AI and telemedicine, we can reach to the masses and we can give a very good morning in the life of the downtrodden and the poor masses. Okay, again thanks.
I think we are reaching there, and I hope we reach there soon.
Today, actually, Mrs. Patel, she's a Minister for Health. She did say that, and you should be happy for that. She did mention that we are now going to go into equipments, and India is going to increase support to them. Yeah, I just heard her, and she has
We'll
said
share
that.
the video with you, sir. We'll share the video with you. My next question is, how do you see AI helping in early detection of conditions like cervical cancer, PCOS, or pregnancy complications?
In cases of the cervical cancer, smart scope are there which can detect the cervical cancer very early. Even the ASHA workers and ANM can use it at the remote areas and can send the pics to the concerned authorities so that they can tell whether there is any problem or not. And in case of the PCOS, like in AI, in ultrasound, there are the inbuilt apps which can detect, which can calculate the number of the follicles, whether they are less or more, and can detect this.
Okay. My last question is for all of you. Looking ahead to 2030, what's your vision for an ideal AI-driven tele-gynecology system in India? India's smaller cities, basically tier 2 and tier 3.
As discussed, I think it must be very safe, privacy oriented, and reliable, of course, and wherein the doctor and patient both are, have a confidence, and it should be more scientific based, yeah, validated.
And it should be, there should not be any bias in the data. That most of the time we see that the data may be from the urban areas or from the hospitals. So it should also include the rural data also.
I'll add something. So, has there any cases of telegynecology that any of you have consulted recently, and you've seen that this can work. Talking to somebody over a call, or maybe AI. Has there any case? Has there been any case
Yeah,
as of now?
I have managed not many, but few of them, and they send the reports from there. Okay, and from here I would tell them that what could be possibly wrong. So I had a patient where post delivery there was a patient had hypotension, then there was no bleeding, but patient was tachycardia, and there was patient was bad. Now it had missed that this probably patient had pulmonary embolism. They were all thinking in terms of hypotension, tachycardia, bleeding. So they are looking for hypovolemia. They are thinking this is a post-LSCS patient. She must be bleeding inside. Okay. So here, since I had come across such a patient, I could ask them. CTPA was done, that is CT pulmonary artery, and it was diagnosed. And here again, this patient came to tertiary center from the secondary tier, was operated upon, penumbra was used, and the clots were removed. And this patient came back after 2 days back to their hospital. So this can be done. It is workable.
And I have come across a score, gestosis score, in which there are few parameters which have to fill in this, like the age, parity, number of the pregnancies, then the family history, past history, and it calculates the risk of the patient of having the PIH in the pregnancy. So this is the Indian app, gestosis score, and it is very good in predicting PIH in the pregnancy.
I have learned a
I
lot.
have used as a doctor we use AI as a the patient when asked about that some diet chart, special diet chart. Okay, I have diabetes, I have hypertension. So I ask my patient to use AI, and they can put their BMI in that, and they have that chart in AI. Yes, breakfast, lunch, dinner, divided calories and fat, protein, everything divided. They can use that practically.
That's interesting. Probably I'll also do that after the session. So yeah, coming back. How do you think 2020 by 2030 things will change in terms of AI and gynecology?
Coming to the antenatal part of view, they should be aware of what are the ultrasounds that are basic necessity in the pregnancy and menstrual hygiene. And nowadays, I am at least seeing a lot of postpartum depressions and blues, and they should be more aware of that as well than focusing on just the basic stuff.
We are using AI in this IVF also. We can select the best embryos and we can implant them. For best results, we can get the more better results with using AI.
Do you think the costing increases when we
Not
use
that
AI?
much. Not that much.
Okay.
Yes.
At first instant, the costing seems to be increased, but when the result come, then it is not increased.
Okay.
Yeah, what I see is the increased public-private partnership. This is what is a need of the hour. That at one stage we did hear that there is a rural and tier 2, tier 3 and tier 1 divide. So somewhere this should go, this disparity must go. And that is possible and that can be done with use of AI. And 2030 I see this happening more because with more AI platforms coming in, more people accessing them, the technology, at least awareness, that is what we are speaking of now. That is, they know that there is something called as MRI, there is something called as treatment here, and that can be made possible. It is expensive, it is whatever, but it is possible. So that awareness at least goes the first step.
Right. So, what are your thoughts on the same topic?
What's your question?
I wanted to know, do you think by 2030, in next 5 years, things are going to change and people will accept AI more and there will be more technologies and things will streamline in a better way?
People will accept more and more AI because they do not want to go from a village to district headquarters. So they will accept more easily. One first thing. Second thing, how do our government takes it strictly to enhance the technology of the AI. First thing, that the technology should be available at the bigger centers at least, and the most important part of that is that our doctors exist working either in the best hospital of the Bharat or in the biggest medical college of the Bharat. They actually want to be trained because we doctor at least we do not know ABCD of AI, and that should be actually the doctor should be trained and it should be included in the curriculum or even in the textbooks of the high school level. The importance of the AI that we are talking over here, this much of level of the knowledge should be included in the curriculum of the high school, and we should do practice when it is at the medical level. Then it can go to the remote areas, and it will be much cheaper to the health infrastructure that we are catering to the masses in the bigger cities and the two-tier cities, not in the three-tier or four-tier. Okay.
Right. So correct me if I'm wrong. I can conclude this session by saying digital literacy and also teaching doctors, like making them more AI efficient is what we need right now. Okay. Thank you. Yeah.
Actually, doctor needs to be trained. Okay, thank you all guys.
Thank you so much. Thank you
you.
so much,
Thank
all
you.
of you.